President Trump has weaponized the entire government to punish states and political leaders he does not like. And agency leaders are complying with his retaliatory agenda.
During a tense House Energy Committee hearing on Tuesday, Representative Yvette Clarke delivered a sharp critique of the Trump administration's approach to Medicaid funding, raising concerns that could have far-reaching consequences for millions of Americans. At the center of Clarke's argument is the administration's decision to implement cuts and pauses in Medicaid funding, a program that serves as a critical safety net for low-income families, seniors, and individuals with disabilities. According to Clarke, these interruptions are not just bureaucratic adjustments. They represent a direct threat to healthcare access across vulnerable communities. Now, let's dive into the next one. Time to tackle the threat head-on. Let's see how it unfolds.
With that, I now recognize our ranking member of the subcommittee, Ms. Clarke, for her opening statement.
Thank you, Mr. Chairman, and good afternoon, everyone. At last month's hearing in this subcommittee, Democrats expressed our deep concerns with the reckless way the administration was using claims of fraud in health care programs to justify its violent immigration operation in Minneapolis, where 2 Americans exercising their First Amendment rights were killed by DHS officers. President Trump has weaponized the entire government to punish states and political leaders he does not like. And agency leaders are complying with his retaliatory agenda. Unfortunately, it includes the Centers for Medicare and Medicaid Services. In January, CMS notified the state of Minnesota that it was acting to withhold about $2 billion in funding for 14 Medicaid services over the next year. This threatened funding cut will affect home and community-based care for older Americans and the disabled, services for people with substance abuse use disorders, and services for children with autism. Minnesota health officials are pushing back on this threat, saying these cuts would be, quote, disastrous, end quote, for Medicaid beneficiaries in the state. One day after President Trump declared a war on fraud at the State of the Union, Vice President Vance and CMS Administrator Oz held a press conference to announce additional Medicaid funds would be held from Minnesota, which could result in as much as $1 billion in additional cuts. Taking billions of dollars from the state of Minnesota and treating the state like an enemy rather than a partner will not make its Medicaid program any less vulnerable to fraud. What it will do is hurt hundreds of thousands of Minnesota residents who rely on Medicaid services to live independent and healthy lives. And CMS is expanding its so-called investigations to more states, California, Maine, and my home state of New York. It is painfully obvious why these states and Minnesota have been targeted. They are all states led by Democratic governors that President Trump lost in the 2024 presidential election. And in the case of Minnesota, the governor was the Democratic nominee for vice president. He pointed out that the president and the people around him are weird. And now the president is taking away health care from his state's residents. These are the petty reasons why the entire Trump administration is going after certain states and why we can expect they will continue to follow the same playbook elsewhere around the country. And just minutes before the hearing started, the CMS inquiry has expanded to Florida. Politically motivated enforcement has real consequences for our constituents. Medicaid is a lifeline for more than 70 million people in this country. Patients pay the price when billions of dollars are withheld for entire categories of services rather than specific claims. CMS and congressional Republicans want us to believe that the cuts only hurt fraudsters, but in reality, they are intentionally tearing down the Medicaid program. These cuts to Medicaid funding are just the latest Republican efforts to reduce healthcare services. I don't want to see that happen in New York, Minnesota, and elsewhere in the country. Democrats want to improve access and affordability of healthcare for everyone and strengthen the federal healthcare system so it is efficient and sustainable. The abuse of taxpayer dollars is coming from the President of the United States, who is using government resources as his personal revenge fund to punish his political enemies. Congress should not sit by while CMS abuses congressionally appropriated funding to take vital services away from people. We don't need to choose between consistent funding for Medicaid and combating fraud. We can and must do both if we repair the damage being done by this administration and the congressional majority. To start, we need to restore the nearly $1 trillion Republicans cut from Medicaid in their reconciliation bill last summer. Today, we want answers from the CMS Deputy Administrator about the attack on healthcare in Minnesota, any similar plans for other states, and the impact of these attacks on the health of Medicaid beneficiaries. Deputy Administrator Brandt, I hope that this is an opportunity for all of us to finally get some real transparency and specifics from an expert at CMS, rather than the rudderless partisan attacks that we have seen from Dr. Oz.
She framed the issue in practical terms. When Medicaid funding is reduced or delayed, states are forced to make difficult decisions, often cutting services, limiting eligibility, or reducing provider payments. That, in turn, can lead to fewer doctors accepting Medicaid patients and longer wait times for care. Clarke emphasized that these ripple effects are already being felt in districts like hers, where healthcare access is tightly linked to federal support. Clarke also questioned the broader policy rationale behind the moves by the administration of Donald Trump. She suggested that the cuts are part of a larger ideological push to scale back federal involvement in healthcare, shifting more responsibility onto states without guaranteeing they have the resources to handle it. Supporters of the administration, however, argue that these funding adjustments are necessary to control federal spending and improve efficiency. They claim that giving states more flexibility can lead to innovation and better targeted healthcare solutions. But Clarke pushed back on that narrative, warning that flexibility without sufficient funding is simply a euphemism for reduced support. What makes this debate particularly significant is its timing. Healthcare costs remain a top concern for many Americans, and Medicaid plays a central role in addressing that burden. Any disruption to the program doesn't just affect policy. It affects real people making real decisions about whether they can afford to see a doctor or fill a prescription. In closing, Clarke's remarks highlight a fundamental divide in how policymakers view the role of government in healthcare. Is Medicaid a commitment that must be protected and expanded, or a cost that needs to be constrained? That question continues to shape debates in Washington, and as this hearing showed, it's far from settled. Thanks for watching. If you enjoyed this video, make sure to subscribe to the channel so you don't miss our next content.
So, in terms of the impact that it's having, I think we just need to ask